Hello, everyone. Happy Wednesday. Welcome to Beyond Basics, a whole team preventative approach. This webinar is presented by Danielle Avila and Laura Betancourt, and we are so excited to be here tonight. Before we dive in, we would like to just go over some disclosures. We are so fortunate for all of the relationships that we have built along our journey of our hygiene careers. And we just want to say thank you for that.
Hey everyone, I'm Danielle Avila. I am a wife, a baseball and gymnastics mom, a dog mom, a hygienist, and a lover of learning. I aspire to empower as many dental professionals as I can, and I inspire you to never stop learning and never settle for less.
Yay, Danielle. And I am Laura Betancourt. I am a true lover of life. My number one strength, or what I love to call my superpower, is positivity. I love to come into life and all aspects and try to find the silver lining. And even though life can be extremely difficult, and as dental professionals, I know many of us have dealt with burnout and have struggled, to the day-to-day life, but I always try to find that silver lining and look to the positive attitude. I love what Danielle said. I'm also a lover of learning, and I hope all of you enjoy tonight and this next hour with us. Now that we've told you a little bit about us, I want you to know a little bit about our company together. So as individuals and providers, whether you're a dentist, a hygienist, an admin assistant, or a company, it's essential to have a vision and mission. And Danielle's and our vision and mission of El Diamant or LD Coaching is family, faith, and freedom. And our true vision is to inspire others to do the things that inspire them, helping hygienists or other dental professionals see and gain the confidence that they need to take action. And our mission is to empower hygienists or any dental professional to see their highest versions of themselves and reignite their passion and propel our dental community forward.
I love it. So let's dive into all things prevention. As oral wellness providers and advocates of prevention, it is astounding that it is estimated that oral disease affects nearly 3.5 billion people. Crazy. And that is according to the WHO. It is our job to continue to not only educate our patients, but to educate ourselves as our profession continues to only propel forward. It's our duty to help our patients get involved in their own health. And what better way to do that than to help them get involved through the oral systemic link? So the oral systemic link is just one way that we can preventatively help our patients to start taking ownership of their own health. Some of these patients coming into our chairs are going to be in a state of disease, and some patients will come into our chair and they'll be in a state of health. And it is our job to help these patients navigate these waters. It's important that we're educating them on all things, whether that be caries prevention or periodontal prevention. The mouth is, as we know, the gateway to the body. And it is super important that we educate our patients of that link between the oral, obviously the mouth and the rest of the body. I love to tell my patients, while we're going through all of our assessments about that link and the fact that there are over 57 systemic diseases at this time that have links, from our mouth to our body. So that whole oral systemic link. And most of the time the patients are dumbfounded. They can't believe that there is such a large number of diseases ranging from some cancers, diabetes, Alzheimer's. I mean, the list just goes on, and it truly just starts with having that conversation. And as specialists, we need to make sure that we are utilizing specific protocols and catching and intervening at an early stage. So, untreated dental caries or tooth decay and permanent teeth is the most common health condition according to the global burden of disease. This to me just is mind blowing. I know as a dental professional, graduating from hygiene school back in 2008, which seems like forever ago,
We're dating ourselves, Danielle.
I know graduating and just really wanting to provide the best possible care to my patients and help them in any capacity that I could. And obviously, coming out of school, like anything new, you're nervous and you're unsure and you are, doing your very, very best. And as hygienists, I feel like it's our duty to continue to educate ourselves so that we're not just that quote unquote fluff and buff hygienist that can't wait to get that patient out of the chair because they need to get to the bathroom or they want to get a snack. Over the last, 4 to 5 years, I've truly changed, how I practice as a hygienist. And I go into every single appointment asking myself, how can I benefit this patient? What can I do? Or how can I educate this patient to even move them 1% closer to health? And helping them to kind of get to the root cause of the things that we're seeing and helping them to answer the questions that maybe they've have been unanswered for so long. So having changed my mindset around being a true prevention specialist, having multiple tools in my toolbox, I'm very hopeful that we can someday eliminate this number or maybe at least decrease this burden that we're seeing globally. So why is caries increasing so rapidly? What is the root cause and what adjuncts do we have to help our patients? So, like we were saying, what tools do we have as hygienists in our toolbox? Our patients come to us and it's our job to investigate. They may have multiple ailments or be on multiple medications, high blood pressure, high cholesterol, mouth breathing, and it's important that we have different tools to help each and all of these patients. Not every patient should be treated the same. I feel like when patients come into my chair, they're all individuals and they all get treated with individualized, specialized care dependent on what I'm seeing. So it's important that we take all of these things that we've, assessed over the beginning portion of our visit and help those patients move towards health.
Absolutely. I couldn't agree more with that, Danielle.
And how many patients can you think of right now on the top of your mind, maybe from today or the beginning of the week, that are sitting in this neutral zone? So maybe they're coming in and they're still having a couple of bleeding spots upon probing, or we're seeing every time they're coming in, they're having maybe one new cavity and they're asking, why do I keep getting cavities? What am I doing wrong? I'm brushing and I'm flossing. How many patients do we have that are coming in that we're doing bloody prophies on and we're just not seeing improvement? And again, as true prevention specialists, it's our job to make sure that we're moving them from that state of disease towards that state of health. So, a little personal story here as far as, old versus new methodologies go. And for as long as I can remember practicing, and it's been almost 16 years as a hygienist, I practiced so much where it was see something and now we're going to drill. So we're going to just drill and fill. And every time we see something, there was nothing preventatively that we could do. We were just going to go ahead and we were going to start drilling away at that, that almost beautifully sound tooth that maybe had an incipient caries. And my sister came into the office that I was working in. This was about 3 years ago now, and she was a new patient at the office. So we did our full comprehensive eval on her. We did updated x-rays, and I was kind of just educating her, asking her all of those probing questions that we do, kind of, what kind of tools are she using at home? And is she a mouth breather? And kind of all of these little probing questions. And lo and behold, finding that she's a mouth breather. She wasn't using any kind of fluoridated toothpaste or any medicament at home to help. So she was very dry. And the doctor came in to do his exam. And lo and behold, he said, you have 15 areas of decay. And she was dumbfounded. I mean, she couldn't believe that it had just been a short 2 or 3 years since her last dental visit, and she had that many areas of decay. And at that time, wasn't really set up to, take care of all of these cavities at once. And I think that a little bit of overwhelm set in for her. So about a year later, I started working. I had moved on from that practice and moved on to a more innovative practice that had more preventative tools, and we were utilizing more tools to arrest areas of decay, early lesions, that incipient decay. And she came in and we went through that whole, initial evaluation again for her. And we were able to not have to drill any of those teeth, which to me and to her was mind blowing. She couldn't believe that there was, such things in dentistry that would help her. So we were utilizing things such as SDF and such things as Curodont to help to remineralize these two structures so that she didn't have to sit through, 7 different visits at the dental office and spend thousands of dollars that she didn't have. So it just really helped instill more trust in her for the practice that I was working in. And as a provider, she was excited to be at a practice that had more innovative, new methodologies that she could, that we utilize, topical fluoride. We're applying fluoride varnishes to help our patients with the remineralization process at the end of all of our visits. There was just a lot of new innovations and new technologies, and again, new methodologies that we're utilizing currently that are helping our patients kind of move from that state of that neutral zone or disease towards that state of health. And so I just would love for you, if you're not currently utilizing any topical fluoride or any SDF or anything that can help to remineralize or arrest areas of potential incipient decay or caries, that you do a little bit of research and maybe take a webinar or two on those so that you can implement those into your practice, because it will change your patients' lives. Being a true prevention specialist, that's our job, is to always be learning and educating ourselves on ways in which we can help our patients.
I love that story, Danielle, and it resonates so much with so many different people, whether you're a provider, a patient, and it's truly just bringing that prevention to the forefront, right? Prevention is the best type of medicine that's out there. So let's talk about all of our patients when they're coming into the office. What are the 5 pillars of health and prevention that we're going to address with our patients? So we love to have specific protocols for these 5 pillars of prevention throughout our office. So we're creating that consistency and continuity. So everyone's on the same page. As soon as that patient's walking in, they're understanding what all the protocols are for periodontal health, healthy tooth caries free, occlusal harmony, healthy soft tissues and skin, and total health and well-being. So from the front of the office to the back of the office, it's consistent throughout, and everybody's on the same page, walking arms in arms, helping our patients get healthier. So again, those 5 pillars of health, which we're going to go through on how you can create these protocols for your office to implement each pillar of prevention. So again, for periodontal health, evaluate the periodontal pockets and bleeding points and recession. Healthy tooth caries free. We want to be evaluating for that remineralization or demineralization of the enamel. Occlusal harmony, that intervention with myofunctional therapy or orthodontics. And then healthy soft tissue and skin, that visual examination and assessments. So we really, and of course, that total health and well-being. So we're really looking at the whole picture and treating our patients on their individual needs so that we can ultimately meet our patients where they're at providing that patient-centered care. This is the foundation of how we treat our patients as a whole and creating that whole team preventative approach with set protocols in place. Especially because we know so much more than we ever once did, right? It's all about that biofilm. There's been that paradigm shift, and there's been a change in the philosophy of prevention and the etiology of dental plaque or biofilm. So we've gone from the traditional non-specific plaque hypothesis to keystone pathogen hypothesis, which is derived from basic etiological factors. We now know that the traditional dental cleaning of simply removing plaque and primarily focusing on calculus using hand scalers doesn't adequately disrupt all of the biofilm that's in place. The nature of biofilm enhances the component of bacteria's resistance to both the host's defense system and antimicrobials. So if it's not removed on a regular basis and adequately, that biofilm undergoes maturation and resulting in that pathogenic bacteria complex that leads to those cavities, the gingivitis, or periodontitis. So we want to make sure that we're disclosing and looking at this, that biofilm and showing our patients and truly meeting them where they're at. Because we're not just tooth scrapers, we're biofilm blasters, we're oral wellness providers, and we're true prevention specialists. So now that we've reviewed some of the tools in our toolbox to learn about new innovations and technologies and really understand those 5 pillars of prevention, it's all about reigniting our passion and helping provide that optimal care to our patients. I'd love to dive in on discussing all periodontal protocols in regards to prevention. So I know protocols can be boring. I'm a total protocol nerd junkie. I love protocols. I think that they're so important because of how it creates that consistency and continuity throughout your entire office. Because again, you want to create that whole team preventative approach. So specifically for periodontal protocols, first, we want to do that initial assessment. We want to perform a comprehensive periodontal chart for every patient every time. And then we want to go on to that categorization of our patients. Are our patients healthy? Are they presenting overall healthy with localized plaque-induced gingivitis? Or are they a true gingivitis patient? We want to make sure that we're noting if it's generalized or localized, moderate or severe gingivitis, or is our patient overall reduced periodontium secondary to clenching or grinding? Are they presenting at a stage 2, grade B? These are the things that we need to make sure that we're documenting because we want to explain the nature of the periodontal disease, whether or health that our patients are in, as well as the consequences the disease the patient might have. And then the importance of treatment plan. So we're treatment planning. So we're really educating our patients and we're helping motivate them and meeting them where they're at, providing that patient-centered care and developing that personalized treatment plan based on the severity of periodontal disease and the patient's individual factors. A few tools that we love to utilize. So we personally utilize Florida Probe. It's voice technology, and it helps get our patients involved. So when you're using that Florida Probe, you're talking into the AI and it's talking back at you. So when you're saying, 3, 2, 4, 3, 2, 5, then all of a sudden it's repeating back to you and it's saying 5, danger, danger, you're going to get that patient involvement. The patient is going to hear you say bleeding points or where the plaque index is. And that is so important for the patient to have true understanding. One of my favorite things is pulling up the risk assessment and seeing this spider graph. And if your patient does have those systemic diseases present, you can actually click off and it will toggle this spider graph back and forth. So the patient can see if they were to stop smoking or even cut down, that spider graph chart will go down lower. So they're visually seeing their systemic risks along with their habits, along with the medications that they're having, and that makes a huge difference.
Absolutely. I could not agree more. I absolutely love utilizing the Florida probe, and patients just absolutely love to hear and see from, appointment to appointment how things have progressed. And when they do hear those numbers, they're like, oh boy, like I need to pick it up. So it is just a really great way to get our patients more involved again in their overall health and or disease. So
Absolutely.
let's dive in a little bit more on healthy teeth and caries free. So let's talk about the protocols with caries management. So when we are going through our caries management protocols, we are utilizing camera. We are obviously taking radiographs, sometimes depending on which office, using AI technology or intraoral imaging to assess our patients. This is a really great time for us to sit our patients up when we are taking x-rays or intraoral photos to show them what we're seeing so that, again, they can get more on board with what is going on in their mouth, because patients can't really see in their mouth. They're not looking in to see if there's staining or if there's as a breakdown or leakage around the margins of their fillings. They can't, read radiographs. So it's important that we show them what we're seeing. And then obviously when the doctor comes in, we're having them assess and diagnose. Prevention is first and foremost. We love to utilize different varnishes on our patients depending on the patient's needs. And then also, again, utilizing those minimally invasive technologies and techniques, the SDF, the Curodont, sealants. Sealants are so important for our younger age and also for our adults as well. If you're having patients that are coming in with really deep pockets and maybe some acidic bacteria, why not try to be preventative and apply a sealant here or there? I've done that recently on my husband, so that was really fun to do. And then just having at-home tools for our patients. What are we recommending as far as caries management, preventative tools at home, toothpaste and such. So having different tools in our toolbox depending on our patients' needs. So here are some fluorides on the market. We both currently use the Pro-Fluoride 5%. Love that it has that xylitol component in it. It has a time release of 40 minutes. So telling our patients, no eating or drinking for that 40-minute time release, which is really awesome. It also has, a really good desensitizing feature in it as well, for those patients that are having those areas of sensitivity. So this is our QR code that we have created. So we really wanted you guys to walk away tonight with something that you could take away and implement, whether you're going back to work tomorrow or the next day. I know for me, before I started working at the office that I work in, implementing a varnish protocol was near impossible. It was really hard to get all of the other hygienists or the doctor on board. So you can go ahead and you can scan this QR code, and there are 3 different protocols that we have created, dependent on specific fluorides that you're wanting to use or currently use. One is a nanohydroxyapatite fluoride application. One is going to be for the Pro-Fluoride application. It's going to be the fluoride varnish application. And then also the Cervatec. So it's important that we utilize this protocol and help integrate this into our office as a whole team preventative approach. Other tools, again, that we have in our toolbox are going to be that SDF. So I absolutely love SDF, again, for those patients that maybe don't have insurance or have a very extensive treatment plan, and that they're not going to be able to get to all of the areas of decay right away. I love to place fluoride on any of these areas, all of my incipient areas, just to buy these patients more time, because obviously preventatively, we don't want these areas to progress or get any worse. So it's our duty to provide our patients with the tools that we have in our toolbox to help arrest or stop. Or again, this is a really great desensitizer as well. When we are using it as a silver-based fluoride, it will stain the teeth. So you'll see that dark black discoloration. So it's important that we inform our patients that it will, in fact, change a carious lesion dark. When we are using it as, sensitivity reduction, and helping with prevent that, it's not going to stain sound enamel. So it's important that we, let our patients know that if we're just maybe helping with the root on 20, the cervical area, excuse me, on 20 to help with some desensitizing, that it's not going to stain, I think is really important. So
Absolutely, I agree with that.
yeah, so here are some of Laura and I's very favorite at-home products and recommendations that we utilize in office for our patients. We absolutely love supporting other professionals as well. And we recently read an article from Jeanette Diaz, and she wrote an article about Remin Pro, and we just absolutely loved everything that she was saying about that the state that it is karyostatic, that it defends against demon and it neutralizes acid. I absolutely love the Remin Pro because it's a water-based, it's a cream. So that's a really nice tool for our patients that, maybe flavor wise or SLS, like there's no SLS or anything like that. It's not bubbly or anything. So it's very calming and soothing to the mouth. It has kind of that trifecta, which we really, really love. It has the sodium fluoride, it has the nanohydroxyapatite, which is that naturally occurring mineral in our enamel, which is becoming really big in the dental world, which I absolutely love. And then it also has that xylitol component. We also really love the fact that it's allergen free. There are a few different flavors. So there's a melon, a mint, and a strawberry. So it kind of can be used, throughout all ages, which is really nice. It's not like just that straight mint flavor for the adults. You can also use the Remin Pro chair side. You can use the CDT code 9910 if you're going to be using it for desensitizing, for like a desensitizing application as well. So here are some more preventative tools, because we just absolutely love to have an expansive toolbox at work of all the different tools and remineralization products to help early stages of caries and intervention. So we currently use the Curodont, which is going to be in that lower left there. We currently use the SDF there, which is a great tool, which we've talked about. And then the Pro Fluoride varnish is awesome. I love it because again, it contains that xylitol. And I know Laura really, really, really loves it and has a personal story to share.
I do. I do. So, I have a 10-year-old son, and we found out that he had a slew of allergies when he was 9 months old. And it was really scary. To give the backstory, our doctor, his pediatrician said to, go ahead and give him a little bit of peanut butter. It's fine to introduce it now. And I introduced the peanut butter to him. Just so happened to be the day of his 9-month appointment, and he got immediate edema of the lip. And, immediately took away the peanut butter, brought him to the doctors, gave him Benadryl right away. They ended up giving him more, and he ended up having an anaphylactic reaction. And we ended up doing blood work, and come to find out he had a slew of allergies: peanuts, tree nuts, shellfish, milk, eggs. Thankfully, he's outgrown some of them, but still is highly allergic to a few of them. And the Profluoride does not contain pretty much all of the major allergens. It doesn't contain tree nuts, peanuts, corn, shellfish, eggs, milk protein, soy, gluten, triclosan, petroleum, the red dyes or artificial coloring, saccharin and aspartame. It's amazing that you just don't have to worry. And for me, that is huge. My son also loves it because of all the flavors that it has. So he's like, this is amazing. So when you are implementing those varnish protocols, it's important that, we're treatment planning and putting out those correct codes. So when we do use Profluorid, we do that D1206 for that topical application. And SDF, you could always do the code treatment plan, the code D1354. And it's just good to make sure that we're putting those codes when we're doing that. That's important. But that's my story of the allergies. Thank you, Danielle. And the next, third pillar of prevention that we'll kind of go into here and discuss the protocols that we can have is, occlusal harmony. This is when we can really intervene with myofunctional therapy or orthodontics. I'm sure many of us have had patients that have come across the fact that we do periotherapy and for whatever reason they're still bleeding or they're not getting better, and it's because their occlusion is off. So when we're creating those protocols for digital scanning or discussing those occlusal harmony protocols, we want to make sure, again, that we're assessing the need for digital scans based on the patient's treatment plan and clinical indications. We want to discuss the importance of occlusal stability in preventing dental issues. We want to go on to informed consent and explain the purpose and benefits and procedures of digital scans for the patient so they understand why they're getting it done. Of course, we want to make sure that we're prepared and ensuring that proper infection control measures are in place. We want to make sure that we're setting up those digital scan equipments appropriately and ensuring that everything's properly calibrated and functional. And then we want to actually take the scan, capture the digital scan of the oral cavity, and guide the patient through the scanning process, explain to them, what you're capturing, where you're capturing it. And then you want to review those digital molds for accuracy and clarity and telling the patient, what you're seeing and documenting the findings and communicating those results with the patient. And then, of course, once that's complete, you want to follow up and schedule any necessary follow-up appointments that may be needed, whether that be a consult for Invisalign or a referral out. We know that pictures are worth 1,000 words. So when you're taking your intraoral pictures or intraoral scanning, it really helps drive that treatment acceptance, and patients understand it. They love before and after pictures, or even taking a picture of a healthy tooth versus an unhealthy tooth so they can see the difference. Taking pictures or even doing a scan, so they're seeing bleeding sites or depths. With those digital scans, you have used iTero, and I love how the patient can see everything. It's capturing any calculus formation, recession, their gingival health. You can pull up the NERI so you can show them the difference of interproximal decay. Again, that occlusal harmony, showing them the hot spots where they're biting. All of this is so important to create and capture that full picture for our patients so we can create that patient-centered care and individualized care, meeting our patients where they're at. Of course, with all that said, it's so important to really meet our patients where they're at and understand what their chief complaints are, and utilizing each of these 5 pillars of prevention and health appropriately.
Absolutely. So let's move on to the 4th pillar, which is going to be healthy, soft tissue and skin. I absolutely love this one. And I think that it is so important that not only are we doing our overall clinical assessments as far as caries and occlusion and periodontal assessments, but we're also assessing our patients visually. So when we're laying our patients back in the chair, we're doing that visual assessment. We're checking their neck and their head, their face for any asymmetries or any swelling or lesions. I like to palpate lymph nodes. I like to tell my patients, we're going to go ahead now. We're going to, check for any lumps or bumps that don't belong, if that's okay. And patients are always like, yeah, and like a little bit of a massage. They love that part.
Mhm.
And then moving on from there and doing my TMJ evaluation. And if there's any clicking or popping, any discomfort for the patient. And then moving on and checking inside their mouth, the palate, the lips, the buccal mucosa, the floor of the mouth, really doing that overall evaluation, that comprehensive, intraoral, extraoral evaluation. After I've done all of this, checked for tori, is there a narrow palate, how's their airway, like all of these things, this is the time in the appointment where I will take my gloves off and I will write down what I've seen, because we all know that at the end of the appointment, majority of the time, we're going to totally forget everything that we saw that we thought we weren't going to forget, but we do forget. So I do think that it is really important that we take the time to make those documentations. Maybe we have that chicken scratch so that at the end of the day, when we're writing our notes, because let's be honest, who really writes their notes between each patient? That we remember these things, and so that everything that we see and say and do for the patient gets transferred into that chart. Inform our patient when we are finding something. It's important that we have those conversations. Did you eat something hard and crunchy? Did you bite your cheek? Did you burn the roof of your mouth? Like all these little things, all these little questions and these probing questions, we can actually get a lot out of our patients. When we see something that maybe the patient hasn't seen, or there was no real reason, rhyme or reason why it's there, that would be a time to, refer or potentially follow up and schedule them back in 2 weeks, whether that be with the doctor or the hygienist, just some time in the chair to make sure that that area has resolved. And again, making sure that we are documenting all of these findings.
Yeah, I love Danielle when we say, when you see something, you say something, right?
Of course, absolutely. I could not agree more with that. Absolutely. And then moving on, we always do, as part of that whole head and neck exam, we like to do the oral cancer screening. So making sure that when that patient is sitting up and when that patient is lying back, we're doing all those palpitations, having them move their tongue left and right to the roof of their mouth, checking underneath their tongue, because it's important and early detection can save lives. And we are probably seeing our patients way more and looking in their mouth way more than anybody else is. It's a proven fact that patients see us way more than they see their primary care. So it's our duty to make sure that we are checking, as diligently as we can. And again, informing our patients of any concerns. If we're seeing something, maybe it's indicating something for that patient, whether that be a vitamin deficiency or possibly an autoimmune disease. It's just really important that we dictate these early warning signs and that we're seeing on our patients.
I couldn't agree more with that. And that just brings us to the last pillar of prevention, really discussing their total health and well-being, because it's so important that we create protocols that we're really looking at the full picture. In the dental profession, we're kind of like detectives sometimes, really putting the puzzle pieces together. And when we look at the full picture and we're looking at the oral systemic link and we're bringing awareness to our patients and discussing that interconnectedness of oral health with overall health and well-being, it shows our patients that we care. And we want to make sure that we're utilizing our full appointments times to truly listen to our patients and understand their goals and be able to relate that back to their health. And then we can determine, do we need more than what we're already doing? Is salivary diagnostics a good option? Do we need to look into the airway? There's so many tools in our toolbox that we can utilize to bring that total health and well-being total overall well-being. Because think of what we deal with in our day-to-day life. Think of the diseases that we're encountering, whether it be stress or mouth breathing or a patient complaining that they're just exhausted. But, oh, I'm always exhausted. I never sleep, but I have kids, right? I'm not supposed to sleep when I have kids, but you are, and there's different things that we can do and help bring awareness and understand and just help put those puzzle pieces together for our patients. One of a newfound love for me is understanding airway and myofunctional therapy and really asking those probing questions to bring awareness to our patients and help them understand that they don't have to be exhausted, or the fact that they might have hypertension because they don't have adequate oxygen supply at night. And that's putting pressure on their heart, which is elevating their blood pressure. A great tool that you can use is to discuss the Epworth sleepiness scale and have your patients fill that out. It's a great way to start the conversation with patients and help bring awareness, or even utilize some of these probing questions. Are you ever waking up with headaches or muscle aches? Are you clenching and grinding your teeth throughout the day or at night? And once you are able to open up your airway and myo eyes, you can't unsee it. I wish we had more time to dive in onto the airway and myofunctional therapy, but we're staying focused on that true prevention right now. But I encourage you and implore you to take more continuing education classes and continue learning, because as dental professionals, we really want to be able to meet our patients where they're at, and creating that co-diagnosis with the doctors, with the hygienists, with the assistants, and most importantly, with our patients. We want to be able to truly listen to our patients and help them understand. Right, Danielle?
Absolutely. I could not agree more. I think that it is so important. And I know that we've talked about this and touched base on this as far as listening to our patients and meeting them where they're at. But it's important that we really find out, what is our patient's why? Why are they here? And what are they looking to get out of this appointment? What are their goals? And really just relaying that message back to them. Like, this is what I'm hearing. This is what I'm hearing you say. And these are the tools and these are the things that I know I could help, implement with you so that together we can get to that state of health. So it really is important to just have, effective communication with our patients, educate them, empower them. I had a conversation yesterday with one of my patients. He came in, he was a new patient, and we go through all of the questions and we ask all the things. And one of my very first questions for my patients is, what does your current home care look like? Are you brushing twice a day? And his initial reaction was, I said, so you're brushing once, twice a day? He's like, no. And I was like, okay, so how many times are we brushing? What does your home care regimen really look like? And he said, to be honest, I'm brushing once a week. And I'm initially, of course, I was like, oh my God, like what? But I took that time to really, sit knee to knee with the patient and educate him on the importance of why we tell our patients to brush. And I said, I'm not doing it for my health. I'm not doing it just to talk because I like to talk. I'm doing it because there is a true reason why, and really getting into the nitty gritty of why it's important. And he was so happy. He was like, you know what? Nobody's actually ever taken the time to explain to me why it's so important to brush. He's like, that makes so much sense. I can do that. No
And
problem.
I love that, Danielle, because you just created trust with that patient, and trust
Absolutely.
having that open line of communication. It's amazing.
And everything throughout that whole appointment from start to finish, having those conversations, being communicative, sitting the patient up, showing them the x-rays, showing them all of my assessment findings, using visuals, I know Laura uses AI technology. Like having all of these things really does help take the no out of the treatment plan acceptance for our patients, because from the get-go, they start to trust us and they trust that we have their best interests at heart. And we truly just want what is best for them. As, dental professionals, we obviously came into this profession to help others and to help and to serve. And so I think it's important for a recipe for a yes to educate our patients again on why. Like tell them why. If somebody's going to tell you you should floss twice a day, well, okay, that's great, but like why? And inform them if it's going to be a cost, if you're going to be doing a fluoride varnish application at the end of all of your appointments. Is it okay if I apply a fluoride, a remineralizing fluoride varnish at the end of your appointment today? It's going to help to, lock in and seal around all of these restorations that you have, the crown margins that you have that are open. It's going to cost $37. Is that okay? And the patients are 99.9% of the time going to say yes.
Mhm.
Obviously having that conversation, you're educating them on why you're going to apply the fluoride varnish. You're just not asking a standard question. You're educating them while you're asking them the question. And I guarantee majority of the time patients will say yes.
Absolutely. I totally agree. And it's helping them understand, why utilizing fluoride varnish is so important because it's going to help create, prevent caries, decrease hypersensitivity, and help prevent dry mouth. I mean, how many patients have dry mouth, right? It's,
Absolutely.
yeah,
Absolutely. The tall component to a lot of the fluorides on the market is huge in helping with dry mouth and increased salivary flow, which is really important for a lot of our patients that we're seeing that have kind of those patients that say they have soft teeth, I like to say. Um, so here are just some key verbiage that Laura and I really like to use in the op. Um, we now know it's important that we have that conversation, and it's okay for us to be seeing these patients for 15 years and come in one day and have something new to say. I think that is so profound that we can come to our patients and say, I've educated myself, I've done some research, and we now know that X, Y, and Z. We now know that bacteria recolonizes every 30 to 90 days. I think it's so important that I see you back in my chair in 3 months because we're just not really getting anywhere with the 6 month cleaning. There's too much blood, there's too much inflammation, and you're just in a state of disease. And I would like to help you get healthy. So, prevention, bleeding. It's important that we're not saying like a little bleeding, there's a little bleeding, or there's a
I
little
hate
cavity.
that word.
Yeah. So you can go ahead and screenshot this, but this is just really some great verbiage tools that we use with our patients to help them understand, where they are as in the health of their overall their mouth and
Yeah,
what.
absolutely. I love that, Danielle. And it's really about bringing awareness to our patients and truly believing that knowledge is power and it should be shared. So when we're learning new things and we're expressing that to them, our patients love that. Danielle and I are in the middle of taking a myofunctional therapy course right now, and my eyes are just being opened, and I'm talking to my patients about this, and they're like, "Wow, this is awesome! You continue to learn." I'm like, "Yes, we always are continuing to learn," and it's important when you're talking to your patients, you're fully taking that full medical history. You're talking to them about their nutrition and discussing the importance of airway, truly asking those probing questions. Um, and ultimately, we want to do this together as a team, right? Because collectively, when we work together, our patients see it. Teamwork makes the dream work. And when everybody is on the same team and has that same vision and mission to provide optimal care to our patients and lead our patients with love and empathy and help them, and have that effective communication as team members, as a company, then we're in the morning huddle, we're meeting and we're getting excited for the day to help our patients get healthy. We're checking in throughout the day. If you have downtime, does anybody need help? Or if you're running behind, ask somebody for help. Utilizing that effective communication with your team is just as important as having effective communication with our patients. And when we can have that effective communication throughout our team, we're helping truly provide that preventative care. So, what are our ultimate takeaways? We want you to truly understand what your why is, what your vision and mission are. Understand that there are so many tools in your toolbox to help prevent disease. And we want to help meet our patients where they're at to help provide that patient-centered care. And protocols are an excellent way to do just that. Continue to discover new innovations in technology and work together as a team and have that communication throughout with your team and with your patients. And we just want to thank you for showing up for yourself tonight, and learning and continuing on your growing journey. We're so happy to have been able to present this to you, and we hope that you take away some valuable pearls from today's presentation. If you have any questions, feel free to email us. And actually, I think we have some time to answer a few questions now, right, Danielle?
We do. So, first question is from Jessica. It is, how are you monitoring enamel remineralization slash regeneration?
Great question. So on your follow-ups, through your radiographs, use those intraoral pictures. Make sure that the caries is not progressing.
Absolutely. And I know that there are technologies out there. We've utilized a couple too to help to kind of see if there's any calcium releasing from the enamel. So we've used those kind of technologies, which is really cool.
Yeah, calcium is great.
Yeah, so we've had that, and obviously like the breakdown of white spot lesions and stuff like that, just really monitoring and utilizing remineralization products, fluoride, hydroxyapatite, all of those wonderful things, xylitol, Curidon, all of that. We have Samira. What is the name of this probe system? Oh, the probing system that we utilize is the Florida probe. And then we have a question from Lisa. How do I get a dentist on board with better prevention and less drill and fill?
Oh, I love this question. Have the conversation, Lisa. Do your research. Come up with research on all the preventative tools that are out there and how you can be more preventative. Look at there's so many CEs right now. Say, hey, I just watched this awesome CE on prevention. Would you like to watch it? Share your information, share your knowledge with them, and have that conversation.
Yeah, absolutely. I couldn't agree more. And like we talked about the vision and the mission, making sure that you align. It's really important that there's alignment, and yeah, have that conversation and have that open communication that you as a hygienist are looking to expand and implement new innovations or technologies or products into the office to help with overall patient care. And I mean, what dentist wouldn't want to be on board with prevention? Because let's be honest, there are enough patients to go around that are going to still need to sit in the doctor's chair, regardless of the amount of prevention that we provide.
Absolutely.
Another question from Samira. Have any of your patients gotten upset with SDF placement color change, even if informed beforehand with a consent? I have never had a patient get upset. I don't know if you have, Laura.
Yeah, no, I have never. No, because we have that conversation and they're aware of it. But no, I personally have never dealt with that.
Another awesome thing that I would say too, if it's a posterior area and you're able to place like a glass ionomer sealant over it,
Yeah.
it's a really great way to kind of cover up that discoloration. So that's maybe a
Yeah.
little tool or a tip that you could have in your back pocket for those patients that maybe get upset.
Yeah, especially those anterior teeth, you could totally put glass ionomer over that.
Yeah. Let's see, Angie, how do you explain to patients of different culture and who speak limited English why it's important to brush and floss? I would say visuals go a long way. So having like Laura and I have laminate stuff in office of like periodontal disease and the stages, having mouth models in the office for the patients, maybe
I was
getting
just,
some help translate.
yes, I was just going to say that, Danielle. I was going to say, translator, you can absolutely do if, especially if the language barrier is so significant. I would highly recommend a translator. And then models. I love my tooth models.
Awesome. Let's see. Um, okay, this is from S. Kim. Do you mind going over the codes that you mentioned, please? So
Of
the
course.
codes, go ahead, Laura, you got that.
Yeah. So for SDF, it's D1354. And then for for varnishes, it's going to be D1206. What's the other one? If you're using the Riemann Pro chair side, it's D9910. I think those are the codes. Those are the only codes we went over, right? SDF, varnish, fluoride varnish, and the Riemann Pro chair side. Yeah, those are the
Yeah,
codes.
awesome. Um, there's a question from Carrie about the Curodont rep. Carrie, if you want to email us, we can definitely get someone to help you out there. So definitely email us about the Curodont rep. We'll be more than happy to help. What is the best product for sensitive teeth?
Oh, I mean, there's so many.
I was gonna say that's like a such a hard
There's so
question.
many. I mean, for sensitive teeth, I love Riemann Pro because of the trifecta that it has. It contains, oh boy, what happened? It contains, the nanohydroxyapatite, the xylitol, and the fluoride.
Awesome. I love the Pro Fluorid L too. Is really great for desensitizing from Voco. So if you get a chance to get your hands on that, that's a really simple chairside application as well, and it works really great. Um, should every patient come for a routine perio maintenance every 3 months, or is twice a year prophy light scaling okay? No. Strong hard feelings about this. This is great.
You want to take this one, Danielle?
Yes. Once a perio patient, always a perio patient, and they should be coming every 3 months, regardless. It's so important that we get ahead of the biofilm. So even if the patients get healthy, quote unquote, and there's no bleeding and inflammation, if we're seeing them in 3 months and they've gone towards health, it's important that we stay on that trajectory with that patient and keep them on that 3-month recall.
Absolutely. And for patients, just in general, I can't tell you how many patients that I have that have localized gingivitis, and I have them coming in every 4 months because we just know so much more about that biofilm. And again, we want to move our patients towards health and get them out of the state of the disease.
Absolutely. So many questions. What do you say if patients don't want fluoride? I love
Great.
this.
Yeah, great question.
We had on our varnish protocols, it's called FIG, FYGG, Feed Your Good Guys, and that is a nanohydroxyapatite based remineralization varnish that we apply. So we like to kind of have something for everybody and have all the tools in our toolbox. So that's where that nanohydroxyapatite really does come in and help a ton. And patients are always on board for that remineralization.
Absolutely. There's that. There's Cervitec Plus. And that's why, again, it's so important to have different tools in your toolbox.
Absolutely. What are your thoughts on brushing? Well, twice a day as prevention. I believe adults do not brush twice a day. I think that it's important that we educate our patients on the importance of disturbing the biofilm every 12 hours. And obviously, we can only do so much, and we can't brush the teeth for them. So,
Yeah,
um,
so true. All right, I think
what,
we have time for one more question? It's almost
yeah,
8.
all right, two more questions real quick. Um,
Time's
what
up.
pediatric toothpaste do you like?
Oh, my son, if speaking from personal experience, so my son personally uses either Happy Tooth or oh God, Danielle, help me out. Why am I totally blanking? Um,
Oh, he uses the Riemann Pro. He likes the Happy Tooth. He likes Boca. There's Risewell.
Risewell, the cake batter one.
Yeah, there's so many. If you want to email us too, like if anybody has any questions about product recommendations or anything, feel free to email us or like one of these, avenues, social media, Instagram. We'd be more than happy to answer any or all of your questions. Um,
Last
when
question.
I know, I'm like, there's so many. So this is from Rima. If there are healthy, if patients are healthy, meaning 2 to 3 millimeter pockets, do we still walk them out as D4910? If they,
So
and you go.
you got it. You want me to get
Yeah.
it? So if they've had periotherapy, if they've had the scaling and root planing in before, then they should always be a D4910. That's perio maintenance. If a patient has never had periotherapy and they're healthy, then you would want to walk out an adult pro, which is D1110. All right,
Awesome.
everybody. I think that's it. We're so excited. Thank you again.
So
Danielle.
sorry for all of the questions that we didn't get to, but like I said, if you guys want to email us, we would be more than happy to answer any and all of your questions. Thank you so much for spending the time with us tonight. We truly, really appreciate all of you being here, and we hope to see you all soon.
Yes, absolutely. We're here to support you any way we can. Have a great night, everybody.